Welcome to Study Session 3, Clinical Psychology and Other Allied Mental Health Professions. Introduction. Clinical psychology is the branch of psychology that is concerned with the assessment and treatment of mental illness and disability. It has several closely related health fields which include pediatrics psychology, neurosciences, and neurology. In this study, therefore, you will learn about other closely related fields of clinical psychology, which counseling psychology, school psychology, psychiatry, psychiatric nursing, and rehabilitation psychology. Learning outcomes for study session. At the end of this study, you should be able to 1. Explain counseling psychology. 2. Discuss school psychology. 3. Explain psychiatry. 4. Discuss psychiatric nursing. 5. Explain rehabilitation psychology. Counseling psychology. It is important to distinguish between counseling psychology and counseling. Counseling is a generic term used to describe a range of mental health professions with various training and license requirements. Counseling psychology has a great deal in common with clinical psychology. The roots of counseling psychology can be traced to the vocational guidance movement, in which knowledge of personality traits, aptitudes, and interests that affect job performance and satisfaction were applied to help match employees with most suitable jobs. After World War II, the Veterans Administration contracted with universities and colleges for services advising on vocational and educational matters. Historically, the distinction between clinical and counseling psychology was in terms of the severity of problems treated. Traditionally, the focus of clinical psychology was on the assessment and treatment of psychopathology, that is, manifestations of anxiety, depression, and other symptoms that were of sufficient severity to warrant a clinical diagnosis. On the other hand, counseling psychologists provided services to individuals who were dealing with normal challenges in life. Those predictable developmental transitions such as leaving home to work or to attend college, changes in work or interpersonal roles, and handling the stress associated with academic or work demands. Simply put, counseling psychologists dealt with people who were, by and large, well-adjusted, whereas clinical psychologists dealt with people who were experiencing significant problems in their lives and who were unable to manage the resulting emotional and behavioral symptoms. Another distinction between the two professions was the type of setting in which the practitioners worked. Counseling psychologists were most commonly employed in educational settings such as university counseling clinics or general community clinics in which various social and psychological services were available. Clinical psychologists, in contrast, were most likely to be employed in hospital settings, both in general hospitals and in psychiatric facilities. These traditional distinctions between clinical and counseling psychologists are fading due to changes within both professions. Nowadays, counseling psychologists provide services to individuals who are having difficulty functioning. For example, treatments for university students suffering from disorders such as major depressive disorder, panic disorder, social phobia, or eating disorders. Both clinical and counseling psychologists are now employed in a wide range of work settings, including both public institutions and private practices. School psychology. School psychologists have specialized training in both psychology and education. Educational psychologists are concerned with psychology as it pertains to education. Their activities include the design, development, and evaluation of materials and procedures for education and training. They are usually employed in an applied setting such as a public school system, the military, or a large industrial concern. They also are concerned with the development, administration, scoring, and interpretation of psychological tests. For instance, there is always a psychologist or counselor in the secondary school who attends to students. These tests are used mostly for screening the mentally retarded people with brain damage, those with learning disability, educationally backward pupils, and children who are emotionally maladjusted. Given the focus on children's functioning, there is a natural overlap between school psychology and child clinical psychology. Historically, school psychology emphasized services related specifically to the learning of children and adolescents, including the assessment of intellectual functioning, the evaluation of learning difficulties, and consultation to teachers, students, and parents about strategies for optimizing students' learning potential. Clinical child psychology focused on the treatment of diagnosable mental disorder. Currently, the role of school psychologists has expanded to include attention to social, emotional, and medical factors in a context of learning and development. These changes, combined with legal obligations that schools provide the most appropriate education for all children, have resulted in school psychologists diagnosing a range of disorders of childhood and adolescence, as well as developing school and or family-based programs to assist students in learning to the best of their abilities. School psychologists have also taken a leadership role in the development of school-based prevention programs designed to promote social skills, to reduce bullying, to facilitate conflict resolution, and to prevent violence. Psychiatry. Although we are focused on psychology-based professions thus far, it is important to note that primary care physicians provide more mental health services than any other healthcare profession. As medical generalists, these physicians are usually the first healthcare professionals consulted for any health condition, be it physical or mental. Psychiatrists are physicians who specialize in the diagnosis, treatment, and prevention of mental illness. As with other medical specialties, training as a psychiatrist requires at least 3 years of residency training after the successful completion of basic medical training. Once they have completed specialization in psychiatry, psychiatrists rarely examine or treat the basic health problems that were covered in their medical training. Psychiatric training differs in important ways from applied psychology training. First, psychiatric training deals extensively with physiological and biochemical systems and emphasizes biological function and abnormalities. Psychiatrists are well qualified to determine whether mental disorders are the result of medical problems and to unravel the possible interactions between physical illnesses and emotional disturbances. Psychiatric training provides the skills to evaluate the extent to which psychological symptoms result from or are exacerbated by medications used to treat physical ailments and chronic illnesses. Many psychiatrists have become active researchers and have contributed in important ways to the knowledge base of the neurosciences and human sciences. Nevertheless, the average psychiatry resident receives far less training in research than does the average graduate student in clinical psychology. Another fundamental difference between training in clinical psychology and psychiatry is that psychiatric training generally emphasizes psychopharmacological treatment over psychological treatment. Accordingly, compared with psychologists, psychiatrists tend to receive less training in the use of scientifically based psychological assessment and psychotherapy. Historically, psychiatrists were trained in forms of psychoanalytic and psychodynamic treatment, such as those developed by Sigmund Freud, Carl Jung, and Alfred Adler. Due in part to the proliferation of effective psychopharmacological treatments in recent decades, and the growing emphasis on evidence-based practice in psychiatry, there has been a waning of emphasis on training in psychoanalytic and long-term psychodynamic psychotherapy. Despite a tendency for many psychiatrists to favor psychopharmacological approaches to treatment, psychiatrists were among the pioneers in the development of evidence-based psychological treatment. Aaron Beck was the primary developer of cognitive therapy for depression and subsequently other disorders. Gerald Wiseman was the primary developer of the interpersonal treatment of depression, and Isaac Marks has played a prominent role in the development of cognitive behavioral treatments for anxiety disorders. Thus, although the relative emphasis of psychotherapy within the profession differs from that in clinical psychology, the provision of psychotherapeutic services remains, for many psychiatrists, a central aspect of psychiatric services. Psychiatric nursing. Psychiatric nurses receive their basic training in nursing as part of a 3-year program to be a registered nurse, in addition to specialized training in the management and treatment of persons with mental disorders necessitating admittance into a healthcare facility. Psychiatric nurses spend several hours in close contact with patients in the process of providing care. As a result of this proximity, they are in the best position to receive relevant information in relation to patients' hospital adjustment and play a vital part in fostering a suitable healing environment for the patient. They work in close collaboration with a psychiatrist or clinical psychologist, and they carry out treatment recommendations. They cannot conduct psychotherapeutic sessions by themselves, but provide help to professionals. They are, however, responsible for managing administrative matters in inpatient settings and supervising ancillary services provided by others, such as nurses, aides, and volunteers. Psychiatric social workers. Social workers help you to be a better person. They tend to help disturbed individuals, families, and or groups to restore or improve their emotional and social functioning by attempting to deal with the social forces contributing to the individuals, families, and all groups' psychological and social challenges. Social workers emphasize the importance of removing or reducing the impact of social circumstances that impede development. Many social workers function as part of a mental health team in the role of taking case history, interviewing employers and relatives in order to understand the possible social causes of the emotional problems, and they are sometimes involved in making arrangements for vocational placement of patients as they get better. Compared to the training of clinical psychologists, a psychiatric social worker's training is rather brief. The responsibilities of a psychiatric social worker are also not as vast as those of clinical psychologists. In contrast to clinical psychologists, who provide services at clinics or hospitals, psychiatric social workers are more likely to visit the home, workplace, or the patient's neighborhood and other places where the patient spends much time in order to better understand the peculiarities of the patient's social life that may be contributing to his or her problems. Rehabilitation psychology. The main focus of the rehabilitation psychologist is on persons with physical or cognitive disability. The disability may have been due to a birth defect or as a result of certain illnesses or accidents later in life. The rehabilitation psychologist helps the people with disabilities adjust to their disabilities as well as learn to deal with the psychosocial, physical, and environmental barriers that often go along with disabilities. For instance, government and NGOs create centers for learning and empowerment for the disabled. They are mostly found employed in rehabilitation centers. Other mental health professions. The other areas closely related to clinical psychology includes health psychology, pediatric psychology, neurology, neurosciences. Summary of study session. In study session 3, you have learned that 1. Counseling is a generic term used to describe a range of mental health professionals with various training and licensure requirements. 2. Educational psychologists are concerned with psychology as it pertains to education. 3. Psychiatrists are physicians who specialize in the diagnosis, treatment, and prevention of mental illness. 4. Psychiatric nurses spend several hours in close contact with patients in the process of providing care. 5. Social workers tend to help disturbed individuals, families, and/or groups to restore or improve their emotional and social functioning by attempting to deal with social forces contributing to the individual's, families, and/or groups' psychological and social challenges. 6. The main focus of the rehabilitation psychologist is on persons with physical or cognitive disability. This is the end of study session 3. Thank you.